Welcome back. Today on ABC 7 at noon, we're bringing you a special two-part segment about being aware of the signs and symptoms of stroke. Earlier this hour, we brought you Diane Nixon's story of her stroke, and now we're welcoming her doctor, Dr. Salvador Cruz Flores, the chair of neurology at Texas Tech University Health Science Center El Paso. Welcome.
Thanks for having me. A pleasure to be here.
Well, it's great to have you here as well. Tell us a little bit about who might be at risk of stroke.
Generally speaking, people over 50, I mean, the older we are, age is one, people with diabetes, people with high blood pressure, people with a condition of the heart called atrial fibrillation, people that smoke are at particular risk. The other part nowadays in COVID year, I think it's well known that COVID also increases the chances of having clot forming in different parts of the body, and the brain is one of them. So COVID is a potential cause for stroke as well.
That's really important to know, especially right now. Talk about some of these signs and symptoms that people should be looking out for.
I think that the most important signs and symptoms that people can look for is having trouble with speech, slur speech, or inability to speak, double vision, loss of vision, weakness, clumsiness, or numbness in one side or the other of your body, or trouble walking that occur rather suddenly. All those, any or all of those changes are potential symptoms for stroke, and people should be aware that the first thing that they need to do is actually go to the hospital. Either have a family member call an ambulance, or the family member, loved one, take the person to the hospital. They should not wait, and that's an important consideration nowadays in COVID times, because people, there is good information indicating that people are trying to avoid to go to the hospital because fear to the virus. And it is well documented that now people with strokes or heart attacks are showing up to the hospital late because of this fear. I think it's important for people just to forget about that fear. They need to have either heart attack, or in this case, the stroke, being taken care of.
That is a really important reminder. We don't want to be putting off those important medical appointments or even going to the hospital for something as serious as this. Thank you so much for bringing these tips and for joining us.